All right, Shalom. All praise, glory, and honor to Yahweh, Ba'ashem Yahweh Shai, Ba'ashem Rakah Kodash. Double honor to the apostles and elders of Great Millstone, and peace and blessing to the elect. I have another GMS News and Prophecy. And I have an article here from abcnews.go.com. And this headline, sick Venezuelans flee to Colombia in mounting refugee crisis. Now, as always, if you've been paying attention to the news, you know what's going on down there in Venezuela. There's been an economic crisis down there that has led to major hyperinflation over the last couple years, which I believe this year, 2018, is supposed to increase to over 13,000% inflation. So basically, the paper bolivar, which is the currency that the Venezuelans use down there, which, by the way, the Venezuelans are of the tribe of Asher, of the nation of Israel. All right, that currency that they use down there is worthless. Okay, there's people even, using it to make art and things like that. It's not even a true currency at this point down there in Venezuela. So what the president of Venezuela, Maduro, has done is he's begun to institute a new currency, which is a cryptocurrency, or it's in the process. It's a cryptocurrency in the process in Venezuela right now, which is based off of Venezuela's great oil reserves. All right. So that's how he plans to get their economy back in order. But in the meanwhile, there's all kind of anarchy down there in Venezuela. A lot of people have been getting sick. They have illnesses and they're not getting their medications down there because over the last year or so and in recent months, the hospitals have not been able to take them in. So as of this article, they're now fleeing into Colombia. All right, so I'm gonna get into it. Okay, which the Colombians are also of the tribe of Asher. They're just a neighboring country in South America. All right, but they're also Israelites. Hey, and this is the judgment of the Lord. This is the judgment of Yahweh Ba'ashem Yahweh Shai in these last days. To those tribes down there. Okay, the Northern Kingdom. So it says, in a cramped hospital near Colombia's border with Venezuela, migrants filled stretchers bearing the wounds of the deteriorating nation they left behind. An 18-year-old woman rubbed her swollen belly after fleeing with her infant daughter when the wounds from her C-section began to ooze pus. All right, hey, it's going to be a little, maybe not too graphic, but it's going to be very descriptive, And this is just part of what we have to deal with, and it's also what's going to come to America as well. All right, so this is like a precursor. So you got to understand these things through prophecy. All right, so it says a young man whose femur had torn through his skin in a motorcycle crash needed antibiotics for an infection. An elderly retiree with a swollen foot arrived after taking a 20-hour bus ride from Caracas because doctors there told his family the only treatment they could offer was amputation without anesthesia or antibiotics. And that's because the hospitals can't get it in. They can't get the imports in. So it says, if you want to sign. All right, and this is a quotation. It says, but we are not responsible for the life of your father. Teresa Tobar, 36, quoted the doctors in Venezuela as telling her when they handed over the papers to authorize her father's surgery. It says, as Venezuela's economic crisis worsens, rising numbers are fleeing in a burgeoning refugee crisis that is drawing alarm across Latin America. Independent groups estimate that as many as 3 million to 4 million Venezuelans have abandoned their homeland in recent years, with several hundred thousand departing in 2017 alone. Many of those migrants are arriving by foot in Colombia and landing in the Andean nation's emergency rooms with urgent medical conditions that Venezuelan hospitals can no longer treat. All right, and this is the reality that's going on down there. You know, it's not on CNN. You know, CNN is worrying about whether or not Russia rigged the 2016 election, elections or whatever. Worrying about, how much money Black Panther has made in theaters. Meanwhile, there's an actual international crisis going on down there in Venezuela that can affect the economy of other nations, but it's not shown here in America. All right, but this is the reality, and these are things that brothers should really be paying attention to and not worry about the other things. Okay, only as it pertains to the scriptures. All right. So it says, according to health officials, Venezuelans made nearly 25,000 visits to Colombian ERs last year, up from just 1,500 in 2015. Oh, that's a hell of a jump. You go from 1,500 2 years in 2015 to 25,000 in the next 2 years in 2017. That's a hell of a jump, man. So that that lets you know what's going on down there, okay? It says that hospitals in border cities like Cucuta, patients are packed side by side on stretchers that spill into hallways, not much unlike the deplorable conditions they fled back home. Authorities project that Venezuelan admissions to Colombian hospitals could double in 2018 and say the nation's already overstretched public health system is unprepared to handle the sudden swell. All right, quotation, it says, we are not in a position to assume the cost of the comprehensive care for the migrants arriving, said Julio Sáenz, an advisor on migrant affairs to Colombia's health ministry. That's a very big concern. It says the Venezuelans are fleeing an increasingly authoritarian government, right, which is basically martial law, all right, that has been unable to halt skyrocketing inflation that renders wages nearly worthless and forces millions to go hungry. So it's a famine down there. All right, you got sicknesses and illnesses, diseases down there, the pestilence. You got martial law. That's what's going on in Venezuela right now, and it's spilling over into Colombia. All right, and I believe you're having different protests down there in South America as well. And you got things brewing up in Brazil. All right. Now the prophecies in the scriptures, they speak about uproars of the people in the world with perplexity. Okay. That's in Luke the 21st chapter. So this is the time that we're living in. We're living in the time of the last days when the Lord is judging and punishing the world, but yet He's going to send back His Son as well to deliver and save the elect of Israel that will listen to Him, okay? So it says in Cucuta, ground zero for an exodus that has spread across Latin America, migrants say their nation's rapidly deteriorating health system is also forcing them to leave as everything from simple antibiotics to critical chemotherapy drugs become hard to find or impossible to afford. Yeah, it's also forced them to leave as everything from simple. Okay, Salakia. It says, let's see. I don't want to read too much. It's a pretty big article. I'm going to get the main points. It says, let's hear. It says, at least one Venezuelan child has died in Colombia from malnutrition, seeking treatment too late. And officials say many others are arriving dangerously underweight. So because they're not eating down there. There's no food. Okay? It says health officials are particularly concerned about the spread of infectious diseases. Authorities confirmed numerous cases of malaria, tuberculosis, and HIV among Venezuelan migrants last year. Now that doesn't necessarily mean AIDS. HIV is it's basically the breakdown of the human immune system. All right, but it's a virus which can lead to AIDS. All right, whether it be sexual or non-sexual. Okay, because that's how you know that's how they process the food. They put chemicals in the air and things like that. Even down there in these overseas countries, you know. So you got an increase in these cases and these diseases. So it says and plus the travel and tourism and all of that. It's basically a clusterfuck down there. But this is a sign of the times. It says it's increasing the numbers of some illnesses that we had under control, Cyan said. It says, by law, Colombia's hospitals are required to treat any person, local or foreign, who shows up in an emergency room. But many Venezuelans are arriving with chronic conditions like cancer and diabetes that require expensive continuing care. Health institutions in Colombia are not required to provide those treatments. We handle the emergency room care, but beyond that, there is no more we can do, said Juan Ramirez, director of the Erasmo Males Hospital in Cucuta. See, now, if they were able to apply the herbs and the different medicines of the earth, the people would be in a lot better case. But because Esau is in control of these different systems and the government and the monetary system and things like that, then this is what you get. Scripture says, when the wicked beareth rule, the people mourn. And this is what you're seeing, the mourning of the people, man. All right. Let's see. I'm going to read this. It says, aside from providing health care, border cities are also coping with an array of public safety issues, like a rise in prostitution and groups of men, women, and children sleeping on the streets. There is also a widespread perception of worsening crime, though police in Cucuta say the incidents remain relatively isolated. And, even in Venezuela, people were killing each other down there for food and bread and water and all of that. So it's going to leak over to these other countries as well. It's just going crazy down there. Okay? All right? So it says here, it says President Juan Manuel Santos is under pressure to declare a social emergency, freeing up additional resources, and the top U.S. agency for international development official for Latin America recently visited Cucuta to evaluate how the Trump administration can help its close ally respond to the growing crisis. At some point, it's going to be unpayable, said Juan Alberto Betar, head of the health agency overseeing Cucuta. Because it takes money to send health, troops and aid and everything over there, So they're just constantly going into a higher debt. All right. It says Colombia's health ministry is planning to deploy a half dozen mobile units near the border to treat minor conditions. A Colombia Red Cross medical tent stationed at the foot of the Simón Bolívar International Bridge, where about 35,000 Venezuelans enter the country each day. Most for short stays to find food or work. Scripture says that there shall be no work in these days. There should be no food. All right? It says already treat several hundred each week. Workers said many of the patients arrived after fainting on the journey because they had nothing to eat. So this is what you have to look forward to in these last days. That's definitely coming here to America. All right? But like I said, this is the judgment of Yahweh Bashmi Awashai upon his people. All right? And I'm going to read the scripture and the prophecy to get that. All right? So let's read this. This is the book of Jeremiah 14 and 16. It says, and the people to whom they prophesy shall be cast out in the streets of Jerusalem because of the famine and the sword. And they shall have none to bury them, their wives, nor their sons, nor their daughters. For I will pour their wickedness upon them. And that's because they're not keeping the laws and the commandments down there. They're following the ways of Esau. to follow in the ways of Babylon the Great down there, asking them for help instead of the Lord. So this is what they get. Okay. It says, therefore thou shalt say to this word unto them, let mine eyes run down with tears night and day, and let them not cease. For the virgin daughter of my people is broken with a great breach, with a very grievous blow. All right, and guess who's the one that's bringing the blow? It's Yahweh Basham Bashar, the Heavenly Father's the one that's bringing the blow. Okay? Verse 18, if I go forth into the field, then behold, the slain with the sword. All right? I mean, out in the streets or out in the actual field. And if I enter into the city, then behold, them that are sick, right, which pertain to the article, with famine, and because the people are not eating. Yea, both the prophet and the priest go about into a land that they know not. Verse 19, hast thou utterly rejected Judah? Hath thy soul loathed Zion? Why hast thou smitten us, and there is no healing for us? We look for peace, and there is no good, and for the time of healing, and behold, trouble. All right. So this is what our people is getting. The time of trouble is amongst our people now. Okay. The only people that's going to be healed at this point is the chosen elect, that they are scattered amongst these other nations and in these countries. But for the most part, 2/3 of our people are going to be destroyed here in America and in other places around the world. All right. For what? For sinning against the Lord. I'm going to read this last verse. It says, verse 20, we acknowledge, O Yahweh Bashar Shah, our Lord, our wickedness and the iniquity of our fathers, for we have sinned against thee. So this is why they're going through this down here in Venezuela, and Colombia, and Brazil, and other places in Latin America, and it's coming to America. This is what's going on. All right. All right. So the Lord is getting ready to bring judgment, and he's bringing judgment. But with that, I'm going to end it there. Hope I was edified. As always, this is GMS News and Prophecy. I'm going to give all praises, glory, and honor to Yahweh Basham Shai, Basham Rakar Kwadash, double honor to the apostles and elders of Great Millstone. Shalom.